works for Dr. Chambers on the ODA service. I'm going to pick up with Wednesday morning and afternoon. The other thing that I forgot to mention in the last video was to be sure you bring the consents and the post-op day 0 orders, the post-discharge care instructions, transition for community forms with you on Wednesday morning. Dr. Chambers will sign all the consents at one time, and you can put these other forms on the chart, the post-op day 0, transition to community, and the post-discharge care instructions, so that Rafat can help you fill those out. Hopefully you'll be done with surgery by noon. And there is a triage clinic at 1 o'clock. Again, these are for patients who cannot wait until the next Monday or Tuesday to be seen. Be sure to return them to their appropriate clinic. In the afternoon, you'll be doing dictations for your op notes. There's also a brief op note that you can fill out that you can put on the chart, and then there's a form for post-op checks. All that comes in the bundle from Willie. Be sure to update the ortho list with the surgical information and check for consults in the box in JPI, and take care of the admissions from Tuesday and update the list with that information. Please remember to send the email for we're not doing the weekend list anymore. It's been folded into this ortho rehab post-op note so that you can just send one email. Thursday, if you missed any transition to community forms or post-discharge care instructions, those are under the blue tab. You can fill those out. You'll be doing the dressing changes on post-op day 1, so they can go to the cast room. The dressing change orders and the daily notes for our post-op days 1 through 5 are going to be in that bundle. There's a triage clinic at 11, and in the afternoon you can have surgery with Dr. Eberly. If there is no surgery or for some reason you're not able to go, then you can have clinic with Dr. Longjohn, which is actually kind of a nice clinic to go to because you're not responsible for the patient, and the residents have said that they end up learning a lot from going to those clinics, so it might even be worthwhile to go at least once. Then don't forget to check for admissions and consults and update the list before you leave. On Friday, you have your grand rounds in the morning, and Rafat will be taking care of the dressing changes on post-op day 2. If he's not there for some reason and you end up doing it, if there's any BK patients, just document the pain. We change the wound vac on Fridays and Tuesdays. As I said, this will be done by Rafat. You might want to touch base with him. Also, he may want to touch base with you over who he thinks can go home. We try to get the patients out on post-op day 2, but anecdotally we found they do better if they stay over the weekend. So as I say, they have to look absolutely fabulous to go out on Tuesday. We've already made the appointments for them for the next 3 Mondays for the diabetic foot patients, so that if they do go home on a Friday, they already have an appointment on the Monday. If they're there's every other Friday there's an evaluation clinic with Dr. Chambers in Central Clinic 2, and also there's triage patients at 11. There's usually a lunch and a lecture in the afternoon. Polio clinic, I believe, is every other Friday now. And don't forget to check for the admissions from the previous day and any consults that there might be. And that is it in a nutshell.